In this video, let us look at the adverse effects of NSAIDs. NSAIDs means what? Non-steroidal anti-inflammatory drugs. Okay? Anti-inflammatory. That's all you remember. They'll also reduce some pain. Mainly, right? Pain reduction and reducing inflammation. So first of all, let us look at the names of the drugs. What do you say? Okay, ready? So you tell me all the names that you know. Nimesulide, Dicolofenac, Aceclofenac. Very good. Etoricoxib. Very good. Aspirin, ibuprofen, naproxen, mefenamic acid for dysmenorrhea, etc. Piroxicam, indomethacin, propylphenazone. All these names are something that you are seeing daily in your practice, I hope. Right? So these are what? NSAIDs, non-steroidal anti-inflammatory drugs. They are anti-inflammatory. That's what you have to focus on. They are anti-inflammatory. In non-steroidal means they do not have steroids, like you have the other classification where you have opioid analgesics, right? But these are not steroid. They are not having steroid. So you should remember them as NSAID. Analgesic, that means they'll reduce pain. They can also reduce a little amount of fever, okay? But not that much. So paracetamol is sitting here. Paracetamol is actually coming under this antipyretic analgesic. It is not actually anti-inflammatory, remember. So here we are talking about anti-inflammatory drugs. So nimesulide, diclofenac, aceclofenac, etoricoxib, aspirin, ibuprofen, naproxen, mefenamic acid, piroxicam, ketorolac, indomethacin, propylphenazone. Okay, what side effects can these have? Standard, what do you write in exam for everything? That you will write, right? What will you write? Nausea, vomiting, hypersensitivity, that is skin rash, pruritus here, headache, standard things that you write. Then you write the rare ones. Rare ones, let us write. Rare ones. Renal failure, myocardial infarction, liver failure, seizure precipitation. Then, okay, standard hi-fi things that we write. The in between, actual things that we should know. Now let us look at them. Okay, mainly what you should know, it will cause peptic ulcers. That's why you always add some, with all the standard medication, you add a esomeprazole, omeprazole, PPI inhibitors, right? PPI is what? Proton pump inhibitor. That itself has I in it. Okay, PPIs. So that it will reduce the gastric acid secretion, right? Then it will cause sodium water retention. So it will lead to edema. So it went, the whole point was inflammation was there. It went to reduce inflammation, but it will cause sodium retention. When sodium retention happens, Na+, sodium retention happens, what will happen? What will get retained in you? Water will get retained. When water gets retained, what will happen? Edema will be there. Edema means swollen feeling, right? Water retention. Okay, that is edema, right? So you will have, this is what you have to write actually. Actually, what will you write? Peptic ulcer. Sodium water retention leading to edema. If water is retained, what will happen? Rise in blood pressure. Okay, then some liver enzymes will increase, they are saying. Then it will cause tinnitus, ear ringing. That you can remember, and that whenever ear imbalance happens, you can have vertigo. Thrombocytopenia means low platelet. Low platelet means bleeding, right? Asthma exacerbation. Okay, something that you have to know. Then one more thing that's hiding here is angioedema. Angioedema means what? The blood vessels will leak fluid. Again, that will be causing edema, right? See, this is angioedema, they are saying. The blood vessels are leaking fluid. Right, angioedema. Otherwise, edema, water retention. Sodium retention leading to water retention leading to edema. This again will lead to higher blood pressure because water is retained. So it causes both edema, angioedema. Okay. So this video is extremely important for you because this is your day-to-day life. You prescribe NSAIDs, right? So you should know all the NSAIDs and their side effects, right? Okay. Bye-bye.